Hey everybody, welcome. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about how to treat anal yeast infection. By the end of this video, we'll talk about yeast infections, what they are, causes of yeast infections, including causes of anal yeast infections, and tips for how to treat anal yeast infections. So let's dive on in. Did you know that yeast infections are quite common? In fact, about 75% of women will experience a vaginal yeast infection at some point in their lives. And while it's less common, men can also get yeast infections. Now you might be wondering, is it really that common? And I'm going to tell you, yes, it really is. Now, that's for a vaginal yeast infection. It's important to note that yeast infections can affect many different parts of the body, including the mouth, oftentimes we call thrush. It may involve the vagina, the anus, as we'll be talking about today, the penis as well. Yeast infections can affect anything. A yeast infection is caused by the fungus Candida, and this can engulf many different tissue organs. An infection occurs when this yeast overgrows, which means there's much more present wherever we're talking about, more than ought to be. The question here today is, how do we treat an anal infection? Before we talk about that, you may wonder, well, how do we get anal yeast infections? There are several different ways that this may happen. The first is that you may have had a recent treatment with antibiotics. Antibiotics will attack bacteria, and oftentimes that bacteria could be good bacteria and bad. It is very hard for antibiotics to specifically go to a bad bacteria and kill that one bacteria. And so what happens is that in the middle of your treatment, whether you had an ear infection, a skin infection, a stomach infection, regardless of where the infection resides, taking antibiotics may kill and affect good bacteria, especially in your gut. And where is your anus? Well, your anus is essentially the end point of your internal digestive system. This starts from your mouth to your esophagus, to your stomach, to your intestines, to your large intestines, and then to your anus. And so it's a part of that important tract that is being affected by antibiotics that you may take. The second is that you may have a weakened immune system. And this could be because you're on steroids. It could be that you're dealing with an underlying condition, like a medical condition, that leaves your body in a weakened state. Whenever you're in a weakened, immunocompromised state, you're more susceptible to infections. And those infections may be in places that are not typical, such as a yeast infection in the anal area. Next is you could be a diabetic. Diabetes in general will cause your overall system, your tissues, your cells, your organs to not function normally, especially with sugars and carbohydrates. Research has shown that carbohydrates and imbalanced sugar levels may lead to yeast infections, whether it's in the mouth, the vagina, or in the anus as well. Excessive moisture below may also put you at increased risk of developing an anal yeast infection. Yeast in general loves moisture, regardless of where it's found, in the vagina, in the anus, in the mouth. Whenever you are excessively sweating or there's moisture in the area more than it should be, you may develop a vaginal or an anal yeast infection. Lastly, I'd like to mention here that another cause could be poor hygiene. It's important that we clean the anal area normally, and by normally, it may sound like something that we all know, but I'll mention it here to say that we're washing with a light soap and water on a daily basis, and that you're washing from the front to the back, meaning that we are washing from the urethra, the bladder, the front of the pelvic region, the groin, and we're wiping and washing towards your back. And so the anus should be the last part that is being washed compared to the vagina or the urethra. So wash from the front to the back. But studies have shown that poor hygiene can lead to an infection such as yeast infections in the anal region. So now let's talk about how to treat an anal yeast infection. The treatment is very similar to that which you would use for the vaginal region. There are ointments or creams in the form of a suppository that can be placed in the anal region for treatment. Over-the-counter treatments such as clotrimazole can be bought and can be used in the anal region up to twice a day for even 1 to 2 weeks to help the clear of this yeast infection. I will mention that if you think that you may have this yeast infection, it's best to have it actually tested and evaluated by a provider, because while you may have symptoms of a yeast infection, which may include itching in the area, when it comes to the anus and the GI tract, there are other things that can cause itching in that area as well. And so it's important to be evaluated to be sure that your symptoms are actually being appropriately treated with over-the-counter products, such as these suppositories. You may also treat an anal yeast infection with an oral or by mouth medication. This medication will need to be prescribed by a provider, whether that is your GYN or a GI or gastrointestinal doctor. Either one of these providers can help you get this pill that you can use to effectively treat your yeast infection anally. As with taking any other medications, I always recommend that you support your system by taking probiotics as well, especially if you're getting antibiotics for an infection treatment of some kind. Most probiotics will have cultures or species that would be helpful to support your gut. It will be helpful for supporting the vaginal area. And all in all, probiotics will help to protect the anal area as well. I have a few tips for if you are dealing with an anal yeast infection, what to do, as well as how to prevent them. The first is that always wear loose clothing. It's very important that the area is not very tight or restrictive in any way. So your underwear, if you do wear them, should be quite loose and comfortable and breathable as well. Next, if you are wearing underwear, it's best for you to wear 100% cotton underwear if possible. Cotton is very absorbent and it tends to wick away moisture in the area. And so especially if you're getting treatment, cotton is always best. Avoid irritants. It's kind of hard to do this, but I recommend that you try. Irritants are anything that could irritate the skin, especially the sensitive skin down below. And so with that, be very mindful of the detergents that you use to wash your clothing, for instance, or the soaps that you may use to wash your skin when you're taking a bath or taking a shower, because excessive irritants can also make you more prone to getting yeast infections vaginally or anally as well. Lastly, I'll recommend that you stay hydrated. You know, our cells are made mostly of water. And if we're in a dehydrated state, it's very hard for our bodies to do what they need to do to recover and to heal as well. If you stay hydrated, you are giving your body one of the underlying things that it needs to function well. Now, if you're questioning if your lifestyle is best for you as a female, is best for your hormones as a female, I have a free quiz for you today. With this quiz, you're able to assess who you are and to see if there's anything that you're doing that may be affecting how your body is functioning. Go ahead and click that link in the description to be able to access this free quiz today. And if you'd like to have more conversation about this specific topic, go ahead, drop a comment below, share your story, ask your question, and let's help each other as a community of women staying together to help each other. I'm Dr. Perkins. Thank you so much for being here, and we'll see you next time.